Yeah, I would see it.
It runs into
Because it was competing with the RAV4 hybrid.
Well, that's what I have now. My husband wants something that's a little bigger than the Prius.
The hybrids don't have PVC.
Yeah, they do.
The RAV4 hybrid, how old is it?
2021.
Okay, because I'm looking at a 17 and it doesn't have a
Oh,
PVC.
mine has heated seats and steering wheel.
But are you getting rid of the Prius?
Well, it's a 2012 with 224,000 miles and rust is getting to be my issue. So I'm starting to look, it's the adult in me that's going, you should do this, and the child in me is going, this is what I want. So I actually looking for another Prius B, so I'm like, three.
They were going fast.
3 dealers are looking for me. I get 49 miles to the gallon.
I know.
I can't go back to reality.
I have a plug-in hybrid, but I felt the same thing. I could never.
And I have 2 Great Danes that ride.
Oh, wow.
So I have to have the Prius B.
Yeah.
Because I can't look at Sam and Ray and say, sorry, you can't go. My car is too small for you.
No, 2 Great Danes in a car. That's
2 Great Danes in a Prius.
in a Prius. Yeah, I don't know my Priuses, but I've seen your models a large one, but I don't know about them being very
That
large.
gives Mr. Bean vibes to me somehow. You remember Mr. Bean, like in the little car?
Yeah.
Like remember with like the, I imagine like Patty in a recliner on the roof steering with the 2 Danes. With,
It's somewhat close, and it's so funny because if I'm at a stop sign and all of a sudden one of them stands up and turns around, they can stand up and they can move. But it is the clown car with 2 Danes in it. And before that, I had a regular sized Prius with an Irish Wolfhound.
Wow. Yeah, those are big. Those are
big.
big. Tall. Wow.
So that was really a clown car.
Yes.
Just, yeah, I open up the back and they jump out and everybody's just like, how do they fit in there? And do you have a sunroof? No. Oh,
It is 9:59.
All right, let's give it one more.
Okay.
We're just gonna give it 1, maybe 2 more minutes and then we'll get started.
We were somewhere, actually we were at the Farmington Beer Garden. Somebody was
Great
there.
place, I didn't get there this year. Okay.
Somebody was there with 2 Irish Wolfhounds.
Oh, I'm sorry, but I think I saw that on their Facebook page.
I
Do
don't
you
know.
want it?
Yeah, we'll just give it 2 more minutes.
Just tell me when.
Patty on the other side.
Patty on this side. Here or here?
Either way, it just helps me cut that corner off.
Okay. I don't have my watch
Do you
on.
want to shut the door?
You probably should.
Yeah, it might be a little loud. Start when the door's shut.
If I break something, I apologize in advance.
Good. Good morning. Thank you for joining us today. I am Rachel Collmore. I am the manager of Maine's Health Insurance Consumer Assistance Program at Consumers for Affordable Healthcare. We have 2 speakers this morning who will talk about open enrollment at coverme.gov, which started on November 1st. Ann Wollison, Executive Director at Consumers for Affordable Healthcare, and Patty Lovell, Family and Health Savings Program Coordinator and Healthcare Navigator with Western Maine Community Action. Thanks again for joining us this morning. And with that, I'll ask Ann to get us started.
Good morning, everybody. Thank you for joining us. I am Ann Wollison. I'm Executive Director at Consumers for Affordable Healthcare. Consumers for Affordable Healthcare has been designated as Maine's Health Insurance Consumer Assistance Program, and as such, our Consumer Assistance Program staff are trained as certified Maine enrollment assisters. Toll-free and in-person help can be provided to anyone looking for health insurance coverage by calling our Consumer Assistance Program at 1-800-965-7476. We are here today to remind Mainers that open enrollment for marketplace coverage at coverme.gov started on November 1st. Mainers with marketplace coverage, people who are uninsured, and those who are not offered coverage or who can't afford coverage through work should look at their options, and we are here today to let people know that free help is available to sort through those options. We are hearing from Mainers and know many people in Maine are worried about being able to afford coverage, especially marketplace coverage, and especially people who are uninsured or currently have coverage that are benefiting from the enhanced tax credits that are being discussed, or hopefully being discussed before the end of the year by Congress. We are urging people to look closely at their options. We are also urging people who receive a letter from their health insurance carrier who have marketplace coverage to reach out to a certified enrollment specialist, an enrollment assister, who can help sort of compare what they're hearing from their carrier to what's on coverme.gov to make sure that their plans are still affordable and that the plan that's being offered to them by their carrier is still the most affordable plan that can work for them. CoverMe.gov offers resources that can help people compare health plans. For example, it has a shopping tool that can help people who need insurance compare comprehensive health insurance plans, including whether or not your providers are in network and what the cost of the plan are, and how much you may be able to receive to help pay your monthly premiums. We also wanted to make sure that Mainers know about issues that they should be taking into consideration as they're looking into their options. We don't want people to get caught off guard by premium increases in 2026. If someone currently has a marketplace plan through coverme.gov, we urge you to update your contact information as soon as possible with coverme.gov and with your carriers. We urge you to select a plan by December 15th to avoid auto-enrolling or auto-enrollment in the same plan, because that may not be your most affordable option for you or your family. We also urge you, as I mentioned earlier, to look closely at letters you receive from your carrier and to compare that information to information at coverme.gov, and or reach out to an enrollment assister to make sure that the plan that you're looking at is the most affordable and will work for you and your family. We are also urging people to return to the marketplace before December 15th and before January 15th to see if premiums have changed in case the enhanced tax credits are extended for open enrollment or for 2026. We are also urging people to be cautious about selecting alternatives to comprehensive health insurance coverage. Non-marketplace plans are often unregulated and they lack consumer protections like coverage for pre-existing conditions. Catastrophic plans, while maybe appear to look more affordable, have extremely high deductibles, and many people won't know that an unregulated plan isn't comprehensive until they go to get care and they can't access the coverage they need in order to access the health care they need. Consumers for Affordable Healthcare also works with a consortium of Maine enrollment assisters, and I am happy to have Patty Lovell here today, who will talk about help across the state.
Good morning, everyone, and thank you for joining us today. I am Patty Lovell, the Health and Family and Health Service Program Coordinator and a Healthcare Navigator with Western Maine Community Action. WMCA has held the Maine's lead navigator since the first open enrollment in 2014 when we were under healthcare.gov. We coordinate with and have worked with Maine enrollment assisters all over the state of Maine. We, along with other members of the consortium, provide in-person and remote enrollment assistance throughout the state by trained enrollment assisters. We urge Mainers who need assistance with enrolling in coverage to reach out to set up an appointment and get the help that they need. Free enrollment assistance is available across the state, including the community action of Aroostook, Hancock, and Washington counties. Maine Health Access to Care, which is located in Cumberland, Franklin, Knox, Lincoln, Oxford, Waldo, and York counties, Midcoast Maine Community Action, New Mainers Public Health Initiative, Penquist Community Action Program with coverage in Penobscot, Piscataquis, and Knox counties, Waldo Community Action Partners, and WMCA, which provides coverage in Oxford, Androscoggin, and Franklin counties. Again, thank you for joining us today and helping us get the word out that help is available to people who need assistance understanding their health insurance options and enrolling in coverage.
Thank you, Patty. Again, the message here is we know Mainers are worried, but that there is a lot of help available across the state, in-person help, remote help, that can help people understand what their options, what's currently happening in terms of the enhanced premium tax credits at the federal level, and we can also help people enroll in coverage and apply for other programs like MaineCare, for example. And that's all we have for you today. Just hope you'll take the opportunity to let Mainers know that while we know many are concerned about the cost of health coverage, help is available to help them sort through their options. Does anybody have any questions?
Can you just tell us about how many calls you're getting from consumers, what you're hearing from them, and what advice you're giving to people who feel like they're not sure if they can afford this, so maybe they're waiting? Just tell us a little more about what you're hearing.
Yeah. So as we mentioned, open enrollment started on November 1st. So before November 1st, CoverMe.gov had a shopping tool, and it still has a shopping tool where people can go in, provide some basic information, and use the compare plan tool to see what plans are available and how much they'll cost. We are hearing from people who are confused about and concerned about the cost of health coverage going into 2026, and our assisters can kind of help them navigate those plans to figure out what might be the most important thing to be thinking about when you're selecting a plan, and also letting them know that we are still hopeful that those enhanced tax credits will be available to them going into 2026. The reality is people are still eligible for some assistance, and that's why we are urging people to look very closely at what their carriers are telling them things will cost, and then checking with CoverMe.gov or talking to an enrollment assister who can really help them navigate their plan, make sure their primary care doctor and any specialty doctors and their prescription drugs are going to be adequately covered by their plans, and then we can help them enroll in their plans if assistance is needed. We also know that some people have recently lost employer-based coverage, and there are programs that families might be eligible for that can meet their health coverage needs, like MaineCare, for example, that has much higher eligibility criteria for children, for example.
Are you concerned that a lot of people are waiting to sign up, waiting to see what happens, and how many anticipate how many people might drop coverage if they can't afford it?
I think people are probably waiting to see what happens in Congress. We anticipate some people may drop their coverage because they are worried they can't afford it, and that's why we're here today, because there are still affordable plans available, and Mainers should look into all their options before deciding to go without coverage, because going without coverage could increase costs for them out of pocket, depending on what happens to them and what their health care needs are over the course of the next year. And if people opt to go without coverage, it also changes what we call our risk pool in Maine. So the result could be that coverage would be more expensive for everyone heading into 2027.
Are the people who could see, still good deals with their insurance, does that tend to be people who are on the lower income, because the enhanced premium tax credits were for people kind of more above 400% of federal poverty level?
That's a good question, Patty. It's really a mix, but what the data shows is people at the lower income level will end up paying more than people at the higher income level because the enhanced premium tax credits are not being continued at this point. However, people at the lower income level are still eligible for subsidies to help them pay their monthly premium, And some are also eligible for help with cost sharing, like deductibles and co-payments. And that's why everybody's situation is different, and that's why we are urging them to talk to an enrollment assister and sort through their options, so they pick the plan that works best for them, that's most affordable.
One other question. I mean, in terms of people who want to wait, what do you want people to know? Do you want to, like, is your advice don't wait, like look at it now, or yes, maybe do wait a couple weeks and see what happens with Congress?
Well, if people want coverage to start January 1st, they should not wait. They should look at their options as soon as possible. It could be if something changes at the federal level, people will first be notified by their carriers about those changes, but people can still change plans if that's what they decide to do. What we worry about is that if too many people wait till the very last minute and then they find they need help sorting through their options, I mean, we have a lot of resources throughout the state, but if everybody calls the day before open enrollment ends, they might not get the help they need, and we would hate for people to lose out on information that could be really helpful to them. All right, thanks again for coming today. Really appreciate it.